If you get into the room and you start your procedure and you have the wrong catheter, you don't pass that check off, okay? There's 4 different types. So there's a male in and out, there's a male indwelling, and a male intermittent. There's a female indwelling and a female intermittent, okay? So we're gonna put all 4 of those in a jar, and you're gonna pick out which one you're gonna check off with. Okay, so you don't have to do all 4, but you have to know all of them, because you don't know which one you're gonna get, okay? It's just a drawing, okay? So that's why I'm telling you, make sure you know which catheter you're getting, okay, when you get that catheter, all right? Okay, so for a female indwelling, if you do your checkoff sheet, you're gonna have those 9 things on the top, 9, 10, 11, 12 things on the top that you do for every patient, right? You walk in, introduce yourself, wash your hands, provide privacy, name, date of birth, check their armband, all of those same things. So almost everything that, if you haven't noticed that already, you need to do one thing on there. So like for head to toe, vital signs is up there. For vital signs, it was pulses. You need to know pulses, right? So this one, you need to make sure that you're asking allergies, and you need to ask that bliss. So it's an acronym for betadine, latex, iodine, shellfish, and silver, okay? You must ask that. Please don't say, are you allergic to bliss, okay? You have to say betadine, iodine, latex, silver, and shellfish, okay? So those are the things up here. Then you need to make sure that you're telling your patient what's going to happen, all right? Your doctor has now ordered a Foley catheter. It's a tube that's going to go into your bladder to drain your urine, because we need an accurate amount of urine, okay, and so that you stay nice and dry, all right? Whatever reason the doctor has for ordering that Foley catheter. When do I take out a Foley catheter? What is the rule for Foley catheters? You guys know?
3 days.
It's as soon as you possibly can, okay? Because you don't want to leave it in there any longer than is necessary, okay? That's the rule, okay? You don't put it in because you don't want to go and take the patient to the bathroom, okay? It goes in for a specific reason, and it comes out as soon as possible, okay? To prevent that CAUTI, catheter-associated urinary tract infection, okay? And so you need to get it out as soon as you can, all right? For this checkoff, we're gonna say 3 days later, okay? They're gonna want it out, all right? So let's start going down. So the first thing I'm gonna do, those 9 things, right? Are you allergic to any betadine, iodine, latex, shellfish, silver? No, okay. Make sure that my bed is at waist level. And you have 10 minutes to do this checkoff. I am not gonna make 10 minutes because I'm gonna be talking to you about this as we're doing it, okay? So waist is not from the bed rail, but to the bed, okay? So make sure that it's at waist level. All right, then the first part that you're gonna do is not sterile, so you just need wall gloves, right? You already washed your hands, so now you're gonna put on your wall gloves. All right? And then you're gonna tell your patient, okay, we're gonna do some peri-care, so you gotta do your peri-care first. So you're going to put your blankets and roll them up. I'm gonna expose you, and you're gonna roll them up. Okay, you're gonna roll their gown up. Okay, and where does my peri-care exist? Where do I wash from for peri-care? Everybody know?
Front to back.
So, it's from the belly button, abdomen, down to the knees. That's where you should be doing pericare, okay? So, abdomen, inner thighs, peri area, like you're supposed to, right? And then the anus last, okay? So you're doing all of that pericare, and you don't really have to do it. You just have to tell me you're doing it and how you're doing it, okay? So I'm gonna do pericare. I'm gonna wash from the abdomen to the knees, inner thighs, peri area, and then anus last, just like that, okay? Yes, it does come. Most catheters come with wipes. So when we talk about pericare, the most appropriate pericare is doing it with soap and water. Okay? All right? So after I've done the pericare, I'm not going to touch it. I'm going to remove my gloves, wash my hands, right? And now I'm going to get started with the Foley catheter part. Okay? So I'm going to put them in the dorsal recumbent position. That means with their knees bent and their feet flat on the bed. Okay? For females, you want their legs as far apart as possible. Okay? Males, a lot of times they don't bend their legs up, they just put them as far apart as possible for males. Okay? But it has to be in that position. Okay. All right, so now I'm going to make sure my table and everything is there, and I'm going to make sure I have the right bag, and it doesn't have any holes or anything in it. I'm checking the expiration date to make sure it's not expired, okay? All right, then it says, we're gonna open up this catheter kit, okay? So you open up this kit, put this at the end of the bed. That's where you're gonna put all of your trash at. And then I'm gonna put this right between their legs, okay? And then I'm gonna, when this comes open like this, I don't need this part, it's trash. This is cleansing wipes. We already did pericare, okay? We already washed our hands, so we don't need this. It goes in the trash. These are all of our instructions. We already know how to do that. That goes in the trash. This, a lot of times they put on the outside of the Foley bag for your information if you want to put it on there. Not everybody puts this on there. That's trash. And then I'm going to open up my tray. So remember that when you open up a sterile tray, you open up away from you first, okay? And then you open to the sides and then toward you last, okay? So for this, I'm going to open away from me and take this out, and it's trash. Okay, now I'm starting to get to the sterile part, remember? So this is the hard part because you have to remember what's sterile and what's non-sterile. Do I have sterile on? No. Okay, so I am only going to grasp, try to keep only that inch border, right? So when I grasp this, I want to make sure I'm keeping that inch border, okay? And then open these sides. A lot of times I see you guys doing this. Okay, don't do that, okay? You need to actually be watching what you're doing, grasping that inch border, okay, on both sides. Okay, now I'm starting to get into that sterile area, right? So I have to be very careful. So now I'm going to pull back toward me, okay? Keeping that inch border, okay? So now the first thing that I see is my gloves on there. Gloves comes in every Foley kit. However, we want you to use your gloves because that's going to show us you know how to open sterile filled, okay? So when you see these gloves, it should be, oh, okay, I need my gloves on, okay? So you're going to take and pinch and get rid of these gloves. I'm not touching anything else on top, and I'm going to get rid of these gloves. So when I'm taking stuff out of my sterile field, you're going to make sure that you don't run over the top of that, okay? Because think about all of these germs, microbes, hair, everything that can fall down into your sterile field, okay? So you want to take as many things out and around as you possibly can, not over the middle, okay? So out and around. So when I'm here, is this sterile?
No.
No. So I have to keep my hands that are clean above that, especially when I start having my sterile gloves on. So it has to be 6 inches above that dirty, okay? So most people forget that part, they do this, okay? So now you're below your 6 inches, okay? Remember I said, we watch all of those little things for sterile field, okay? So make sure you're how far?
6 inches.
6 inches, okay? All right, so now after I got this, I see that my gloves are there. Now it's glove time. Everybody understand that? Okay, so now I put my gloves on. When you guys do this for real, many times you've used all the Foley trays, okay, for practice, and so you'll have to refold all these trays back. You need to put them in this exact order, okay, because when you do your Foley, you're going to have time to look through that Foley, make sure everything is in there the way it should be. So at that time, you can put your sterile gloves in there, okay? Does that make sense? All right. So right now, I'm going to show you how to take those gloves out and open up your sterile gloves, okay? So, am I sterile?
No.
No. So make sure you've got your eye on there when you're doing this, okay? So, I'm going to open these up, keeping my eye on my sterile field, keeping my 1-inch border for my gloves. Sometimes this will fold back on it. That's why I always try to make sure you guys fold this open like this so it will stay nice and open for you, okay? Pinching to get my dominant hand in first, and then cupping, my thumb is up to get this hand on, watching my sterile field still, okay? All right, now this part is sterile still, right? So I can get rid of it, or I can push it away, okay? My hands are sterile, okay? So now I have to get, now I just go in order the way you see it. So the first thing on there is my pad. This pad goes on first, and it goes shiny side down. Make sure that you're being careful that this doesn't go outside, or many times what happens is you're not paying close attention and it touches the leg, okay? So you need to make sure that you open this appropriately. All right, so one thing that you need to make sure of, shiny side down, so you have to be careful, right? Shiny side down, and I am backing this in like this, okay? Why am I not doing it like this? Why can't I do it like that? Because my arm is over my sterile field. Is my arm sterile right here?
No.
Okay. So that's why we say, open this up, okay, and back it in. So both your hands are behind. And then make sure you're not touching anything, and you drop it. You can fix it later, all right? Then I can take this and put it over the top of that, okay? The next thing down is my fenestrated sheet. It just means that there's a hole in the middle. Fenestrated means a hole in the middle, okay? If there's a shiny side, you put the shiny side down. These, I have not yet seen a shiny side, so if there's shiny, you'll put that down. Remember, I'm still going to back this in and not, and it goes up and over the top, Okay, we'll fix this in a minute, because now I can move this, and I can touch all of this, because it's all sterile, right? And get this all where I need it to be. Okay? Remembering where my 1-inch border is. Okay? See that? Okay. Did I unsterilize myself at any time?
No.
Okay. So now I've got those down, and now I'm just gonna open everything. Okay? So, first thing is my betadine. So we are not really going to open up my betadine in the LRC here. Because as you guys did the bed bath and everything, you saw some of those stains. It stains the mannequin, it stains the bed. So we're gonna just simulate that we're putting this betadine. And that's why we asked them, betadine, iodine, latex, silver, shellfish, okay? So we're simulating putting this betadine on, and then we're taking it out and around, making sure what? 6 inches, okay? Next thing to open is my lube, because we have to lubricate that catheter. So when I put my lube on, I'm just gonna put a drop in here, because we don't need a bunch on this when we're doing it, when we're practicing for these mannequins. If I was to use this in real life, I would just put the whole thing on there, okay? Because it won't hurt anything, okay? But for LRC, just put a daub in the tray here, okay? Out and around, drop it, okay? Next thing is my opening up of my catheter. It's usually got the blue on it. You need to make sure that this just doesn't flop outside your sterile field. So when you do this, you are taking this off. I usually try to keep it kind of rolled up in my hand, because this is all sterile, right? And then get rid of this blue. Drop this back down in here, taking this out and around and dropping it. And then since this is female, how much do I lubricate this?
1 to 2 inches.
1 to 2 inches. So I'm gonna put this in my lubrication, 1 to 2 inches, and leave it there. Make sure it doesn't fly out, okay? And then I have my water, my sterile water, and I'm gonna put this on there and connect it, okay? Make sure it's tight in there. And then out and around for anything I have on here, okay? Now I'm ready. I've opened everything up. I've got everything ready, okay? I'm still sterile both hands, right? Okay, now I have to wash her off. So now this hand, your non-dominant hand is going to be non-sterile now, okay? Because I'm going to touch her. So when you touch, you're gonna open up those labias, okay? And you're gonna wash that area first. So I take my first swab that's got betadine on it, and I'm gonna say, it's gonna be cold, and you're gonna wash away from you first, that labia all the way down, and then taking it out and dropping it. Your second one is towards you, okay? And it is on this side, and you have to keep this open the whole time, because you can't close it, because it will become non-sterile, okay? Out and around. And then my third one is straight down the middle, okay? Making sure you get that urinary meatus. And then out and around. All right, keep this open, don't let go, gotta keep it open, okay? Now you're going to insert this Foley catheter, and you're gonna tell her, okay, you might have some discomfort here. Take a nice deep breath and bear down for me, okay? And then I'm gonna insert this. How far?
Until you get urine.
Until I get urine, okay? And one of the things that gets people is that they start pushing this in. This isn't one to come in. You would not do this, don't look at this part. Okay. All right, So, you put this in, and what gets people is that they touch their hand. Sterile, non-sterile. So make sure that you're walking your hand back and not touching that area when you put this in, okay? So now I got urine back, and then how far do I go? Once I see urine, what should I do? 2 to 3 more inches. Okay, so then I put this in 2 to 3. This is not wanting to go in today. Okay. And then I'm gonna take my non-sterile hand and hold that, okay? To keep it stable so that I can come down here and put my fluid in, okay? So I'm putting my fluid in, okay? At this point, right here, I am no longer sterile. I don't have to be sterile. Take this hand off, and I'm gonna pull back a little bit, because I have to have this hand to take this syringe off, okay? And I'm pulling back just so I know that it's in the right, the balloon is in the bladder, okay? So now, I just gotta finish up and put this on. So making sure all of these are nice and clamped, make sure that's clamped. This goes on a non-movable portion of the bed, okay? Gonna put my stat lock on here. And then making sure the fat goes to the fat side, the skinny goes to the skinny side, and put that on there. This goes on non-movable part of the bed, okay? This green clip just clips onto the bed so that it gives it extra support and doesn't pull. I try to make sure that this is not kinked or coiled so that it has a nice flow. I get urine if I need to get urine, and then I can clean this all up. So I will clean it up, and I'll do pericare again because she has betadine on there, right? Okay, so now I'm doing my pericare again. I'm taking away all my trash and everything. When you do your checkoff, you're gonna leave everything in place because now you have to take it out, okay? So just leave it there, and make sure you say, okay, I'm gonna document it's a 16-French Foley catheter, patient tolerated it well. I got immediate return of clear yellow urine. You're gonna document that COCA, okay? All right, COCA is color, odor, clarity, and amount. Consistency or clarity, yeah, okay? And then you're going to take your gloves off. You're gonna verbally tell me this, because you're gonna take this out. You don't wanna take it out yet, okay? And then you're gonna say, I'm gonna take my gloves off, wash my hands, then I'm gonna go document and document what I'm gonna document, okay? Make sure the bed is lowered, make sure the patient has their call light, all of those things, okay? Then you're gonna say, okay, your instructor is gonna say, okay, 3 days later, let's take it out. Okay, so you're gonna come in. Is taking out a Foley catheter a sterile procedure?
No.
No, it is not. So you only need wall gloves. You can leave these on, okay, while you're doing it. It will save time, okay? So, but know that you're gonna have to say, I would come back in, wash my hands, put my gloves on, okay, to take this out. Explain the procedure to the patient